treatment. Dr. Lederman's custom prostate cancer treatment is all outpatient. Our goals are your best results, avoiding radical surgery, maintaining your sexual and urinary function, and your life. Most insurances, Medicare, Medicaid, accepted. Call Dr. Lederman at 212-CHOICES, 212-CHOICES for a fresh second opinion and free booklet DVD. Not only super convenient, super in Manhattan, 38th and Broadway. To hit the cancer, call Dr. Lederman, 212-CHOICES. Cherish your life. Custom prostate cancer treatment with Dr. Lederman, 212-CHOICES.
Welcome back to the Radiosurgery Hour. This is Rob Redstone here with Dr. Gil Lederman at the WABC studios in the heart of New York City. We're just a few steps from the Radiosurgery New York Cancer Treatment Center on Broadway and 38th Street. Dr. Lederman, the leading cancer expert, treats prostate cancer non-invasively. He was the first in New York with fractionated brain radiosurgery, and he's the first in America and in the Western Hemisphere with body radiosurgery. Hey, Dr. Lederman, we're back.
Hey, we're back. It's Gil Lederman, Dr. Gil Lederman, taking your calls. We're live. We have some good news. One of our patients who we talked about earlier, a man about 75 from Long Island with cholangiocarcinoma, was having terrible pain in his liver, terrible pain in his shoulder. Now, remember, the diaphragm in embryo, when we're a little baby before we're born, comes from that shoulder area. So the cancer in the liver now was following the nerves that were created when he was in his mother's womb, and he was having this terrible shoulder pain, and doctors told him, oh, it's not related. I told him, actually, I think it's all related. I've seen it so many times before, and we've seen so many cancers. That's the advantage of coming to a place that is so busy with lots of experience. So we treated him with radiosurgery, and his son called me this week to say his pain is gone. His pain is gone. He can lay on his side. He can lay upside, downside, on his right side, on his left side. The shoulder pain is gone. The pain is gone in his liver. He's happy. And guess what? So am I. So is his son. The patient is happy. He's comfortable. The pain is gone. And most likely, based on our experience and our data, when we treated cancer, most likely this is going to shrink. Most likely it's already shrinking. That's why the pain's gone. And the pain is gone. So you win double. The cancer goes away and the pain goes away. So it's a double win for the patient, all non-invasive treatment. Now, he'd seen other surgeons. He did not want to have cutting or bleeding or hospital stays. Came to us, trusted us, and did a great thing. Fantastic in the good news department. Now, here's the question news department. A man called this week with invasive bladder cancer. That means it's invading into the muscle. He was seen by his doctor, a urologist, who's a surgeon specializing in the urinary system, which is the kidneys, the ureters, the bladder, urethra, genitalia. He told the man the only treatment for bladder cancer is surgery. Well, that's not true. You shouldn't be afraid of recommending radiation. We do radiation in the stereotactic body frame, so it's more precise, we believe. We can hit the cancer. There's great data showing equivalence of result. So you can have surgery if you want, but most likely for this man, he'd lose his sexual function, his urinary function. He would never urinate normally if he had open surgery. Whereas if he had us, focused radiation, most likely we could stop the cancer. There's a good chance of curing the cancer and continue his normal quality of life. So a huge difference between open surgery. We've talked about brain surgery versus us, radiosurgery. Here's body radiosurgery for bladder cancer versus open surgery. Huge difference in quality of life. So think, a fresh second opinion won't kill you. Maybe it will enlighten you and give you other options that you find more appealing. And speaking of that, we had a woman coming in this week. She came in on Wednesday. She was scheduled to have surgery to remove much of her breast on Thursday. She had a big mass, maybe the size of, bigger than a plum in the breast, involving the nipple-areolar complex on the right side. She had a PET scan elsewhere, so she was staged, and the PET scan showed a mass in the lung, most likely cancer. So could this have been a metastasis, a spread of the cancer to the lung? Yeah. Could it have been a primary lung cancer? Yeah, it's possible. She could have a biopsy if she wants. She was scheduled to have a biopsy. She was scheduled to have a big resection of the breast. After she spoke to us, she understood that resection would take away the nipple-areolar complex. It would take away much of the breast. It would not be a normal-looking breast. She would lose that sensation. And then she would have planned surgery on the lung, whereas with us, we could do radiosurgery, hit the lung cancer, hit the breast, downsize the cancer so that the surgery would be smaller, safer, hopefully to save her nipple-areolar complex. So she actually canceled the surgery on the breast. She canceled the surgery on the lung. She's coming with us for non-invasive outpatient treatment just this week. Came Wednesday, canceled her surgery for Thursday, and got all mapped out for the radiation. So we could do focused treatment on her cancer, on her breast, on her lung, avoiding the hospital stays and the risks associated with hospital stay, like infections and other complications. There's an article this week that looks at dermatologists doing Mohs, M-O-H-S surgery. Mohs is surgery when the dermatologist kind of carves out a cancer. They take a crater and a crater and a crater, and sometimes, in my experience, huge holes are made in the face, eyes, ears, nose, mouth, cheek areas, when we know that radiation is equally effective. We use focused beam radiation, and we have many examples we've given you over the year using non-invasive treatment. It doesn't need plastic surgery to close the wound. It doesn't require hours of operation, where there's no cutting, no bleeding. Our success rate for basal cell cancers and squamous cell cancers and melanoma is very, very high. So it's something to think about, especially for skin cancers around the nose, eyes, ears, mouth, cheek area that is so visible and where surgery really can't, for many patients, create a normal appearing nose, ears, eyes, mouth, or cheek area. So if you have a skin cancer, you may want to give us a call. There are options available. And I want to talk about another man who came to us, heard us on the radio. We have a program on WOR Sunday night, and this man's a taxi driver. There's a taxi show at 8 o'clock, and our show is 9 o'clock Sunday night. He stayed tuned, listened to the show. This man has a sigmoid rectal cancer, spread to the liver. He's 53 years old. He was diagnosed 2 years ago, and he's been getting chemo, and he's tired of it. It's poorly tolerated. Cancer's in 3 particular spots. We saw him, we staged him, and now we're treating him. He just didn't like the chemo, wasn't working well, wasn't tolerated well, and with us, where we treat has high control rates. So this is a colorectal cancer, metastatic to the liver, and we expect good results. Another man from our news department came to us with a PSA 15 Gleason 9 prostate cancer. He's about 80 years old. His life expectancy is another 15 years. He wants to be treated. He doesn't want to die of prostate cancer. He doesn't want the bone metastasis. So we are mapping out his treatment and treating him. We followed him for years with other things. Lymphoma's in remission. Now we're tackling this prostate cancer. My name is Dr. Gil Lederman from Radiosurgery New York. We have a booklet DVD to send to you. We send it at no charge. You just call us at 212-CHOICES, which is 212-246-4237, 212-246-4237. We take most insurances. You can call for an appointment. We're not only super convenient, but we are super. So we thank you for listening. If you have questions, call us day or night at 212-CHOICES. Thank you for listening, and God bless you.
Thanks for tuning in to the Radiosurgery Hour with Dr. Gil Lederman and myself. If you have questions before next week's show, just contact Dr. Lederman at 212-CHOICES. That's 212-246-4237. That's 212-246-4237. This is Rob Redstone. Till next week.
Here's Dr. Gil Lederman, New York's only Harvard-trained, triple board-certified radiation cancer doctor. If chemosurgery or radiation isn't working or isn't tolerated, when cancer and its pain and symptoms aren't getting better, seek a fresh second opinion at Radiosurgery New York's Urgent Cancer Consultants for innovative, custom-tailored cancer treatment. See our experts within one business day because we know your time and your life are precious. Our goal is proper diagnosis and effective, non-invasive outpatient treatment. Decades of leadership, first in New York with brain radiosurgery, first in America with body radiosurgery for cancers of the brain, body, and prostate, all custom-tailored for you. Call 212-CHOICES, 212-CHOICES for a prompt appointment and free booklet DVD. Super convenient, 38th and Broadway, with most insurances, Medicare, Medicaid accepted. You're next at Radiosurgery New York. Just call 212-CHOICES, 212-CHOICES.
You know, when you're talking the big C, cancer, a lot of times people have gone through prior chemosurgery or radiation and it just didn't work or didn't get the desired effects. All of a sudden you want to get an opinion on what to do. Well, Dr. Gil Lederman treats not only newly diagnosed and recurrent cancers anywhere in the body, but definitely will specialize with those folks who have already been through a process. It didn't work, and now they're trying to reconfigure in terms of what they can do, and he goes one-on-one with you. In fact, he'll send you an informative booklet, DVD, and arrange a prompt meeting to discuss all choices at his convenient office located on 38th and Broadway in Manhattan. He's a brain and prostate cancer as well as body cancer expert, also treating breast, lung, pancreas, liver, kidney cancers, and more. And back in 1991, I referred my dad to Dr. Gil Lederman, and he came up with a solution for his medical problem. Harvard-trained radiation oncologist first brought non-invasive stereotactic body radiosurgery to America. He has the longest experience treating cancer using radiosurgery with no cutting, bleeding, anesthesia, or hospitalization. So just call Dr. Gil Lederman for your cancer treatment choices at 212-CHOICES. Write that number down if you want to refer someone to call, or call Dr. Gil Lederman for that person at 212-CHOICES. That's 212-CHOICES.